persons with severe acute respiratory illnesses in hospital, that is, persons who have pneumonias, will be tested. All our healthcare workers who develop any kind of acute respiratory infection will also be tested. All our persons who visit our health centers and our accident and emergency department, we will be doing a sampling of those persons to determine if there is any kind of spread in the community. So not everyone will be tested, but everyone will be advised to stay home if they have any problems and to report if there's any worsening of their symptoms so that the necessary action can be taken. But a certain amount of those persons on a regular, routine basis will be tested across the country from the hospitals, A&E departments, and from the primary care facilities. In addition to that, we will be testing whether symptomatic or asymptomatic direct contacts of those persons who have been confirmed with COVID-19. These measures are in addition to the testing of persons who are suspected cases. In order to facilitate this testing, we have expanded and we are in the process of expanding our testing capacity. We are in the process of expanding our sites for testing. At present, testing is carried out at the National Influenza Center. The Ministry of Health is working very, very hard to establish within the next 2 to 3 weeks the capacity at the National Public Health to also test. We have acquired a machine that is capable of this testing. We have ordered 10,000 tests to be able to be done on that machine.
I use this now not as a threat, not as a warning, but as advice to those who have come into the island between the 18th and the 23rd and who are not maintaining the quarantine rules, that the police and the Ministry of Health have been instructed to go through the manifest, to identify your name and match that with an address, to visit the address, and to determine whether or not you are actually maintaining the self-quarantine or the home quarantine. If not, the government will make provisions for you to be housed in a state quarantine facility and to be charged for the breach. Again, we can take no risks. The government has developed a website to supplement the contact numbers that have been made available by the Ministry of Health, and Minister Tufton, I'm certain, will give you those numbers shortly. But I want to, for the benefit of the public, just read out the website. And for those persons who have come into the island between the 18th and the 23rd, it would be very useful for you to go on this website, fill out the questionnaire, and provide the information to the Ministry of Health so that we can be aware of your health status and be in touch with you to give you any support that you would need. This website is Jam COVID-19, that is JAMCOVID19 .moh.gov.jm.
The government is responding in the way that it has with a care program that is geared towards keeping employees connected with their employers, and where that is not possible, supporting employees who have become disconnected. The systems are being built and designed now. Most of the intervention will take place via an online platform where persons, either through their mobile phone or through a computer, will be able to access, and small businesses and businesses in general will be able to access the system, will be able to put their data, upload their particular data, and importantly, we will require a verification. At the end of the day, this is taxpayers' money, and it's money coming from you as a taxpayer, and you will want to ensure that your funds are going to persons who indeed have been affected by this pandemic.
This is now an official appeal to the operators of all gyms across the country, that we are asking that operations be toned down in order to comply with some of the measures that the government is putting in place as we respond to the virus. The Minister of Finance gave an indication of the support that is being contemplated for certain sectors of the country: barbers and hairdressers, owners and operators of bars and vendors in our markets. There are criteria that will be set out as to how you can access these benefits. And once we have worked out those criteria, we will be putting in motion the system in order to facilitate this operation. We will begin feeding of our homeless population across the country. We will be providing on a daily basis a breakfast between 9 and 10 a.m. every day, and dinner between 2 to 4 o'clock every day. The corporate area, which is the largest constituents of that street population, will be operating out of several locations. In Crossroads, we'll be operating out of the Carib Car Park. In New Kingston, Grenada Way. In Halfway Tree, the Bethel Baptist Church, and the car park at the KSAC, the Kingston and St. Andrew Municipal Corporation building in downtown Kingston. The government, through the Ministry of Local Government, will be making $140 million available to be used amongst councillors. These funds will be used under specific guidelines that is set out by the ministry, along with the Ministry of Finance and the Ministry of Health. And the details of those programs will be worked out, but the benefits of this program is to reach those in the various communities across the country who are affected by what is taking place.
You have heard the Prime Minister mention the question of the feeding program. Well, we have heard them also, and we have listened to the people. And we have decided as a consequence that because of the journey that they had to take and the cost attendant thereto, we have decided that we would add the sum of money for the lunches and the breakfast program and the lunches to the PATH program and pay that monthly. With respect to the holding of the PEP, as anticipated, you must realize by this that the PEP the exams have had to be cancelled for this, or extended, postponed. And so the fact of the matter is that we will be undertaking them in the months of June and July, and they'll be marked in August, and the placements will be made in September. This is the same approach that we're going to be adopted, that's going to be adopted with the CXC, the CSET, and of course, City and Guilds is also looking at the same time frame, same format.